43. That was 2 days because the dashboards don't necessarily come out every day. But I expect it to worsen. Well, the vaccines are working, but we don't have enough yet vaccinated to make a significant difference. When we still have people who are vaccinated getting COVID, although it's mild or asymptomatic. The vast majority of our hospitalized cases are unvaccinated cases. I think we have one unvaccinated case in the hospital. One vaccinated, in the hospital. All the others are unvaccinated. Most are improving. A couple of them are quite severe and serious. And the two most serious ones are, one is in the 40s, one is in the 30s. And so that I think is quite significant. I can go into more detail, but I'm not sure how much of the person's information I can legally say on the radio. Well, I can try and skirt around it. One of the gentlemen presented with from my understanding, with a pretty significant stroke. You don't expect 30-something-year-olds to have strokes generally, but a pretty significant stroke, and was found subsequent with no other risk factors but to have COVID. Sometimes we see those sorts of presentations. Having been looking after patients for since COVID started, we see multiple different presentations. The classic one is the cough and they can't taste and they can't smell, but we see strokes, we see uncontrolled diabetes, we see diarrhea, we see vomiting, general unwell. And so literally we have a rule, almost anybody being admitted into the hospital has to have a COVID test. And we found a number of them by surprise. We have people being admitted for heart issues. Turns out that they have COVID. But so it's pretty much standard policy since last year that anybody being admitted to the medical service at Mount St. John's gets at least a rapid test before admission so that we can isolate.
This is Antigua Breaking News.